to keep my intervention short, but I'm building on actually Sarah's fantastic presentation when she talked about the importance of developing. I think she talked about the positive investment when it comes to older people in the region, and not only the silver economy, but investing in the long-term care workforce and creating jobs, but creating jobs that has future and career progression and opportunities, which is something not easy. It's something internationally is not an easy task to do because of the nature of long-term care. So I'm drawing on some international learning. So this is a piece of work that I am leading in the UK, and it links to the new UK reforms on the social care workforce, which is basically discussing this very topic, how to create a long-term care cadre which have career progression, which you can retain and train well. So basically, this is my team at London School of Hygiene and Tropical Medicine, and we've been commissioned by the Department of Health through the National Institute for Health Research. So just first to think about the social care policies in the UK. In the UK, it's quite, and it sits, you know, the long-term care policy sits at a different space than the health policies. So you have universal health coverage that is free at the point of access, but you have a means-tested long-term care coverage. So not everyone has access to long-term care, but everyone has access to health care. And that creates loads of problems. For example, when is your health need become social care needs or long-term needs? And we find that particularly with older people. Older adults, say, who develop dementia, and suddenly their problem changes from a medical problem to a social problem. And suddenly, when they are covered by the state, they are not covered by the state. They are only covered by the state if they are at very low income. So it creates problems for the individual who uses the service, but also creates a division between the workforce. So the workforce, the long-term care workforce, operates within a fragmented system with less funding than the health care workforce. Their work is characterized by short contracts, by precarious working condition, by fragmentation. They don't have high job security. They don't have lots of benefits of work, unlike the health care workforce. So this creates real issues with the social care workforce. So just to give you a snippet in the UK, the social care workforce is 1.6 million jobs, which is interestingly more than the healthcare workforce in the UK. It's 0.1 million more. So it's actually a very big workforce. And we're only counting those who are formally paid. So there is a lot of informal arrangements, like part live-in care, part domestic care, that the system doesn't know anything about them. So we have, of course, the UK have an aged population, so we have fewer people in the working age. And when you think about how unattractive these jobs are, in thinking about the fragmentation of work, the pay is very low, the conditions, but people come with other motivations, there are lots of vacancies. And migrant workers play a very important role in filling these vacancies. So there are a few issues to consider when you think about this type of workforce. The motivation, why they come to work, the working condition, their well-being at work, what they do, what are their roles and responsibility, and their career progression. So basically, there has been a lot of problems with recruitment and retention. And in 2023, which is only last year, the UK government proposed a new set of reforms. And these reforms aims to address these recruitment and retention issues, but primarily through workforce training and upskilling. So it is creating these new career pathways, new skills, new certificates, so then people can build up a career within social care that could move into health, but also can stay within social care. So these reforms actually comprises of several components. They created a new care certificate. So basically there will be like a minimum standard of training was standardized and recognized. Until recently or until now, These trainings are, they are mandatory training, but they are provided ad hoc at different employers. And in many times, they are not portable across providers. They decided that they will have an envelope of budget to fund new training and qualification for the workforce. They will have a clear care workforce pathway. They will have what they call the digital skills passport to reduce training repetition. So anybody has taken training, whether it's mandatory or additional, will carry that in their passport. And there is something called delegated principles. And I will say a little bit about delegated principles quickly, which means that there is a lot of the tasks that nurses are doing that could be delegated to care workers with the right training. But there is a need for protocol because there is responsibility for these tasks. So we have finished a developmental stage to design an evaluation for this whole program. And I'm going to talk about this very quickly. So we have used a mixed method study. We used a consolidated framework for implementation, but it was very short term, and it was formative to inform the next stage, which is hopefully going to start in July, August this year. So I'm not going to look at this. This is a framework, but it's basically there is a lot of components of these reforms. In terms of the intervention characteristics, it's quite complicated. There is many elements of it. There are sector-wide issues that we need to think about when we kind of develop any intervention to the social care. And there is need for engagement from the sector. There are nearly 40,000 providers providing care in the UK, which is a huge number, and there is not many associations that represent all of them. There are some associations that represent a few of them. I'm going to go delve into quickly the key findings. So what we found from stakeholders, so we did stakeholders interviews, we did policy and document analysis, and we had a very strong conversation with the Department of Health and Social Care, which is actually developing these reforms. And what we found that training can improve quality of care for the clients who are using the service and also for the well-being of staff. There are some local levels, of course, and this is lessons to be taken from the international learning that influence the effectiveness of these training initiatives. One has to think about disparities between organization size, between the settings. Maybe large organizations have have already the infrastructure to career pathways that people can move from one job to the other. They have the HR support, and then maybe care homes, which is more enclosed, compared to home care. They have a registered manager who can actually, create a more conducive environment to training. However, training accessibility and applicability, there are lots of disparities, particularly if people are working at older people's homes, so home care, and we've seen the policy direction that this is the right type of care. If people can remain at home, let them remain at home. But when you talk about their workforce then, how are you going to prepare the training? Where are they going to take the training? There is no physical place for them to be. Do you expect them to have access to online material, expect them to have internet connection? There is a digital divide, even in the UK. And in addition to the local factors, there are national level factors that influence effectiveness. So, of course, the pay and mobility of staff for training, so people have very small wages. Do you expect them to pay for their travel to go and do the training? Do they have control on their time because they work a lot of hours to maintain a decent wage? And then there is a huge political change. The UK has been going through a lot of changes, and even at the national level of funding. So these reforms have been cut into half in terms of funding, just to let you be aware of that. So in terms of implications, there is equitable access. So we found that actually, because the care settings are diverse, as I said, whether it's at home, whether it's a community, there are differences between the two. And again, the characteristics of care workers themselves, whether they are migrant, whether they're English speaker, whether they live in rural places, And we have in the UK as well some devolved nations, for example, in Scotland and Wales, they have control over social care policies, but they don't have control over labor policies or migration policies. So again, they are tied. So basically, when we develop the full evaluation, we have to think about the comprehensive strategy to actively involve all stakeholders. So even if it's a social care or long-term care issue, it intersects with so many other issues that we have to bring all the players together. So how is that useful to the MENA region? There is a lot of international learning opportunities here. So policies can be driven by change, but they also can drive change. And many of that change we found is not always planned or anticipated. So you have to be always active looking to what are the implications. And it's really important to think about context. So we heard the whole morning that the Middle East is heterogeneous. It's not homogeneous. There are different contexts, and within the countries, there are so many different contexts. And also the other thing, when we talk about long-term care and long-term care market, the care markets are not free markets. There is no consumer power. So when people need care, they're usually at a crisis point. There is not much choice. So if they can't find a care agency that addresses their needs and cultural needs, they have to take whatever is there. And that implicates their workforce as well. And it's really important to realize when we create new policies around care that they are not isolated from broader intersecting policies. There are lots of competing policies and megatrends like demography, mobility, and technology. And again, we have to balance between the local, tailored, and central decision power. And as we've been hearing all morning, funding is really crucial. So when you initiate a training initiative, whether it's short-term or long-term, you have to think about how you sustain it, how you maintain it, both in terms of funding and in terms of the content and attracting people for it. And whenever you kind of create these career paths, inequalities and diversity has to be acknowledged because there is differentiated impacts on them. So that's it for me. I just wanted to highlight that this is there, and you're most welcome to email me, and I can send you more material. Thank you.